See, Cryptococcus neoformans, this is very important for the exam, asked over 9 times. So you should know the morphology, the lab diagnosis of Cryptococcus neoformans, and you should also know the cultural characters of Cryptococcus neoformans. These 3 are the topics they have asked always. So this is showing the Cryptococcus neoformans. It actually causes cryptococcosis. Okay, are you awake? So what is this Cryptococcus? It's a fungus. Very good. So let's get started. It causes cryptococcosis. So Cryptococcus neoformans is a fungus. So we are studying it under mycology. So if you remember from our classification in the last video, in fungi classification, you can see that there are yeast. Fungi can be either yeast-like, mold, or dimorphic fungi, which can be both like yeast and like mold, correct? So basically Cryptococcus neoformans is yeast and it is pathogenic. So it causes what? Cryptococcosis, right? So it will be something like this. See, yeast, like budding types. Okay. Got it, right? So let's move on now. So now you know that it is yeast. Cryptococcus neoformans is fungus. It's yeast. It is a pathogenic fungus. It causes mycosis, that is cryptococcosis. So if you look at fungal diseases, that's nothing but mycosis. In that you have opportunistic mycosis, right? You have actually so many types of mycosis. You have superficial mycosis, cutaneous mycosis, systemic mycosis, and opportunistic mycosis, which will affect only people who are immunocompromised. In that you can see cryptococcosis. The other opportunistic mycosis are candidiasis and aspergillosis. So if you want to remember cryptococcosis, you should remember 2 diagrams. This capsulated diagram, okay, it's actually yeast. So you have to remember this diagram, yeast, this budding diagram, and if you remember this diagram, if you remember these 3 diagrams, you may be able to recollect in the exam what actually cryptococcosis is, okay. Now moving on, what and all we know, let us see about Cryptococcus. It's a fungus, it's a yeast, and there are 2 species, Cryptococcus neoformans and Cryptococcus Gattii. Basically, there are others, but in the textbook only these are mentioned. So let us go with Cryptococcus neoformans and Cryptococcus Gattii. These are the species. Serotypes, there are actually many in the textbook. Again, there are A, B, C, D only for you. AB is basically, BC is Gattii, Cryptococcus Gattii serotype, and A and D are actually Cryptococcus neoformans. There are some varieties or something they say. You can just look at that information from the textbook. Basically, A and D will be Cryptococcus neoformans, some variations, and B and C will be Cryptococcus Gattii. Okay, these are capsulated from the beginning. I think we mentioned already. It is capsulated. So you can see in this diagram that they are capsulated, right? They are opportunistic. They cause opportunistic mycosis. What do they actually cause? Cryptococcosis. One more C is there, guys. Cryptococcosis. Okay, right like this. Then what it actually causes, yes, it's an opportunistic infection it will cause. What exactly it can affect? It can affect a lot of things, but remember, especially the meninges, okay, the meningitis it can cause in HIV infected people, obviously because it is opportunistic. But in other immunocompromised people also it can cause meningitis, etc. Okay, let's move on to the pathogenicity, how it occurs, okay. Infection is spread by inhalation, that is what the textbook says, so we will go with that. So aerosols, etc. come as Cryptococcus, and both the yeast and the basidiospores are infective. Basidiospores are nothing but the sexual forms of Cryptococcus. Okay, so inhalation wise, you will get the yeast or the basidiospores, and you will get Cryptococcosis. First, it will go where? The lung, right? From the lung, usually it will go to CNS. Basically, you understand that lung is affected only if the person is immunocompromised, then lung manifestations will come up. It will go to CNS, there you will see the Cryptococcus fungi, meningitis it will cause. Okay, hold on. So obviously it crosses blood-brain barrier, correct? It crosses blood-brain barrier. What crosses blood-brain barrier? Cryptococcus, it crosses blood-brain barrier. Very good. So let's move on now. Where are we? So what happens now, there is something here called as Trojan horse. They are referring to something here as a Trojan horse. What is this Trojan horse? Let's try to understand. Okay, we are currently here. We are trying to understand a term called Trojan horse. So actually this Trojan horse was something like the soldiers were inside, okay, it was a huge horse, and nobody knew that inside the horse the soldiers were there. So the soldiers were able to enter the enemy area hiding inside the horse. Similarly, this is macrophage, and the Cryptococcus enters the macrophage, and it cannot be phagocytized by the macrophage because it has a capsule. So the macrophage itself carries the Cryptococcus to the brain. Okay, so you understood, right? Now moving on. Virulence factors. What and all are going to make the Cryptococcus virulent? Obviously it has capsule, so it will escape phagocytosis. So this capsule is actually polysaccharide capsule. Fine. Then it is anti-phagocytic, and also it inhibits the host's immune response. So anyways, host is immune compromised, and it will also suppress immune. Okay. Next, we are here, phenol oxidase. So what happens here? It is able to produce these enzymes like phenol oxidase, phospholipase, urease, etc. And this phenol oxidase makes melanin. Okay, so the ability to make melanin is also a virulence factor for Cryptococcus. Okay, so remember the virulence factors and repeat them, please.
Virulence factors of Cryptococcosis: polysaccharide capsule. It helps to escape phagocytosis and it also suppresses immune. Then we have phenyl oxidase, phospholipase and urease. Phenyl oxidase, phospholipase and urease. Thank you so much.
Okay guys, now we are moving on to the risk factors in pathogenicity. So risk factors, basically if somebody has advanced HIV, if CD4 count is less than 200 micro per microliter. So if CD4 count less than 200 per microliter, if you can remember, these things are very difficult to remember, I understand. So if there's advanced HIV infection where CD4 T cells are less than 200 per microliter, then they can get this infection of Cryptococcus neoformans. Okay. So if in immunocompromised people, compromised. Okay, so in immunocompromised people, there is a risk factor. If people have malignancies, especially hematologic malignancies, if they have, and if they are organ transplant recipients, or if they are on steroid therapy, then these people are at risk to get a cryptococcal infection. Okay, they are at risk to get cryptococcosis. Is this clear now? Shall we move on? Are you awake? What are we studying? Cryptococcosis. What and all we finished so far? Tell. We saw the morphology, we saw the pathogenicity. Now let's move on to clinical manifestations and lab diagnosis. Very good. Let's move on then. Clinical manifestations. So see, first of all, it enters how inhalation, right? So it can affect the lung, especially pulmonary cryptococcosis happens only if the person is immunocompromised. So this is the first manifestation also. It's common and first manifestation. So you should understand if a person has some problem in the lungs, it could be cryptococcosis. Okay. Then cryptococcal meningitis, it presents with headache, fever, sensory loss, memory loss, loss of vision also can happen. So because of cryptococcosis, because of all that fungus. Then skin lesions. Skin lesions are common, especially with the serotype D, the Cryptococcus neoformans variation of neoformans. Okay. So in that there is more of skin lesion. So skin lesion shown here. Then osteolytic bone lesions can happen because of cryptococcosis. So remember what and all are affected in the cryptococcosis: the lung, then the CSF, obviously the meninges, then skin, and then the bones can be affected. Till now we never saw actually why bones. They didn't explain the bones. However, yes, the bones can get affected. Moving on. Epidemiology of cryptococcosis. There are a lot of cases, 1 million cases worldwide. 6 lakh people die because of cryptococcosis annually. That's too much, right? So now basically, have you seen so many pigeons around you? Pigeons actually pigeon droppings actually contain Cryptococcosis. Now that's scary, right? Oh, wow. So, they actually, where all Cryptococcus will be there in the soil, obviously the pigeons and the avian droppings, right? Avian droppings, pigeon droppings, eucalyptus tree also. Okay. So that is where you would find Cryptococcus. Can you tell me where you find Cryptococcus? Yes. Recollect, in the soil, pigeon droppings, avian droppings, eucalyptus tree, what you will find? What will you find in eucalyptus tree? Cryptococcosis, Cryptococcus neoformans. Let's move on to the lab diagnosis quickly and finish off this video. So, what and all specimens you will collect? You will collect CSF, you can collect blood, you can also collect skin scrapings, okay? So, let us look at the details. So, specimens we collected CSF, blood, skin scrapings, direct detection, you can you can do staining, negative staining to demonstrate capsule, you can use modified India ink stain, nigrosin stain. See, this modified India ink stain, you should remember this one. But actually here what happens, this India ink is actually not very sensitive. So they will use modified India ink stain. They will add mercurochrome, 2% mercurochrome to India ink, and they will make modified India ink stain. What will they add? Add 2% mercurochrome, right? Because India ink is not sensitive, it is less sensitive. Okay, then what will happen? In black background, you will see capsule will appear as a clear space. Okay, let's try to look at that here. See, clear space represents the capsule. Very good. So capsules may be twice as thick as the diameter of yeast cells. India ink stain less sensitive. That's all. Don't worry much. Just add a thing, India ink less sensitive. So you will modify and add 2% mercurochrome. Fine. Moving on to gram staining, it will stain positive. Now that is strange. Gram staining can be used for fungus also. So it will show round budding yeast cells. What will it show? Round budding yeast cells. Obviously, right? It's yeast. Moving on, other stains, you should remember the names. Mucicarmine stain, masson fontana stain, alcian blue stain to demonstrate the capsule. So what and all will demonstrate what? Let us look at this. Alcian blue stain will demonstrate the capsule. Masson's fontana stain to demonstrate melanin. And mucicarmine will demonstrate the cell wall. Wow. Cell wall is demonstrated. Hold on. So just remember mucicarmine stain, masson fontana stain and alcian blue stain to show the capsule. Okay. So capsule you can demonstrate by India ink, modified India ink and alcian blue stain. Okay. Say it. Alcian blue stain and India ink can represent capsule. What and all can, what are the other stains you should know? Guys, this is important question. So please remember these stain names. Okay.
Mucicarmine stain, the cell wall of Cryptococcus. Masson fontana stain to demonstrate production of melanin. Alcian blue stain to demonstrate the capsule.
Thank you so much. Moving on, antigen detection, the capsular antigens, okay, because it has capsule, there will be capsular antigens can be detected, okay, from either the CSF or the serum. You can detect by latex agglutination test. This is actually rapid and very sensitive, 95% sensitive. So you should be able to detect the antigen. So this is a very specific method. You are exactly detecting the antigen. Where's my cursor? Here. So specific it is, okay, it's very specific. It is 95% sensitive and it is rapid also. So what more you want, right? So shall we move on to culture, guys? Culture, you can take the cerebrospinal fluid, CSF, and put it in the Sabraud, S-A-B-O-U-R-A-U-D, Sabraud dextrose agar, SDA agar. Okay, and you can also put it in blood agar, chocolate agar, etc. Blood, if you are taking blood specimen, you can put it in biphasic blood culture bottles. So here, actually, you will keep it at 37 degrees centigrade, standard that you should write, okay. And whatever you will see, colonies appear as mucoid, cream, white, right? And yeast-like. So here you can see mucoid, creamy, white and yeast-like. Now let us go to the confirmation. In lab diagnosis, after doing all this, you have to confirm that it is Cryptococcus. So for confirmation, you have to you can do urease test. Urease test can be positive because Cryptococcus makes urease enzyme. The growth is at 37 degrees Celsius. Oh, so it is at a higher temperature than room temperature. Okay. Then you have niger seed agar and bird seed agar. Like bird seed, okay, it makes sense because it is so much related to birds. Okay, so here you can show the melanin production. You can demonstrate melanin. Demonstrate melanin. Okay, then 37 degrees centigrade means it's higher than room temperature, but actually it is our body temperature. So it grows at our body temperature. There is assimilation of inositol and nitrate, and there is a mouse pathogenicity test. Put it in a mouse and see the pathogenicity. So where exactly we are looking at the confirmation tests for Cryptococcus, right? So how will you confirm? You will put it into some bird seed agar to demonstrate melanin. You will see that the growth happens at 37 degrees centigrade, that is body temperature. You will see that the urease test is positive. There is assimilation of inositol and nitrate. There is a mouse pathogenicity test. Poor mouse has to suffer with the Cryptococcus. So we are done with the lab diagnosis. Let's move on to the treatment of Cryptococcus. Flucanazole. See here, flucanazole for Cryptococcus. We already wrote on it. Flucanazole you can give if there is no CNS involvement, etc. If there is CNS involvement, if the person has HIV, then you can give amphotericin B plus or minus flucytosine, and that's only for 2 weeks. After that, you have to give fluconazole lifelong. Poor guy, how much he has to take? This fluconazole, amphotericin B are all what? Antifungal, correct? So let's take a quick recap of what we have seen in Cryptococcus neoformans. It causes cryptococcosis, right? Then we saw that it is a fungus, it's a yeast. So that's why we are reading it under mycology. It is pathogenic. So yeast means it will look like this. Very clear budding and all that. So it causes opportunistic mycosis, that is called as Cryptococcosis. Cryptococcus, the species, there are two, neoformans and Gattii. Neoformans will be A and D serotype, Gattii will be B, C serotypes. They are capsulated, which helps them to escape phagocytosis. They cause opportunistic mycosis, that is cryptococcosis. They can cause potentially fatal meningitis in HIV infected people. Pathogenicity, it comes by inhalation, right? And both the basidiospores and the yeast are actually infective. So they will reach the lungs, then there will be CNS spread. Remember this Trojan horse word. That is how it reaches the brain. Virulence factors are the capsule, the phenol oxidase, the phospholipase and the urease enzymes. Risk factors are immunocompromised people. Clinical manifestations, obviously the lung, then the cryptococcal meningitis. It can even lead to loss of vision. Skin lesions, osteolytic bone lesions, very unusual, right? And bone lesions can be there because of fungal infection. Wow. Epidemiology, lot of cases in the world. Lab diagnosis, the specimens that you will collect, then negative staining to demonstrate capsule, modified India ink stain, very important. Gram staining, positive gram staining. Remember the other stain here, nigrosin stain. Other stain you have mucicarmine stain to demonstrate the cell wall, Masson's fontana stain to demonstrate melanin, alcian blue stain to represent the capsule. These are all difficult words to remember. Please remember them. Pause the video and remember them. Take a break. Pause the video, remember those stains again, okay? Mucicarmine, Masson fontana, alcian blue stain. Then antigen detection you can do via latex agglutination test. This is very specific, 95% positive, and it's also rapid. Cultures, you will use the SDA, that is the Sabo-U-Raud dextrose agar. This we are doing so that you will write the spelling correctly in the exam. Sabo-U-Raud dextrose agar. Blood agar, chocolate agar. Blood if you take, then you will culture it in biphasic blood culture bottles. What you will actually see, you will see these kind of creamy white mucoid yeast-like growth, the colonies. Confirmatory test, you can use birdseed agar to demonstrate melanin. You can see that the growth happens at body temperature. Urease test will be positive for Cryptococcus because it produces the enzyme urease. There is assimilation of inositol and nitrate. Mouse pathogenicity test to confirm the cryptococcal infection. We saw the treatment flucanazole. Flucanazole, it is antifungal. Amphotericin B for 2 weeks and fluconazole lifelong if they are HIV patients with CNS involvement. That's all for now. See you in the next video, guys. Bye-bye.